So now we need to know that what preoperatively. So every time that we are not going to speak about incisions and types of incisions. It will be the healing that occur when you have incisions and you have the you're going to have the how the wound heals. Is it clear? Those what we're going to we are spoken about first. We are spoken about we are first spoken about the stages of wound healing. Now we are going to explain how the wound heals, by which intention does the wound heals based on the incisions. Is it clear? Now we have different intentions of wound healing. Different intentions of wound healing. Is it clear? There are three major intentions of wound healing. The first intention of wound healing is primary intention. Is healing by primary intention. Now, in healing by primary intention, it is a wound is going to heal by primary intention generally when there are when the edges are opposable. When you have opposable edges, is it clear? Provided that you have a wound like that, is it clear, on the skin and the edges are opposable. Is it clear? So you have a wound like that on the skin, the edges are opposable. Is it clear? So here the healing is going to occur by primary intention, and to favor the primary intention you just need to do suturing to close to oppose the different tissues. Is it clear? So you are going to favor the healing by primary intention by doing suturing. Is it clear? But even if you don't do suturing, the wound healing, provided that there are opposable, meaning that the edges can come together, provided that they are opposable, meaning that the edges can come together, it is going to heal by primary intention. And now suturing only helps such that the stages of the wound healing should take a shorter period of time. Basically, that's where now suturing helps. But when you have wounds that have that has opposable borders, generally they are just going to heal by primary intention. Now suturing just favor the healing by primary intention. Now examples of wounds that are capable of healing by primary intention. The first one, we have incisions during surgeries. Basically, when you are doing an incision during surgery, they are usually sharp and they are opposable. Basically, so even if you leave it like that, it can still heal by itself and it's going to heal by primary intention. And now you can also suture such that it heals by secondary intention. So the such that it still heal fast by primary intention. The next incision the next one, but that is going to heal by primary intention, is that what the wound healing that heals by also by primary intention. We have also lacerations. Is it clear? Lacerations that heals also by primary intention, and penetrating wounds. Is it clear? In penetrating wounds and laceration, it leaves sharp borders, and sharp borders are opposable. Is it clear? So even with or without surgery, the healing is going to occur by primary intention. What is good with primary intention is that there is little scarring. When the wound heals by primary intention, there is little scarring. That's why incision has to be done such that the wound healing it is by primary intention. Is it clear? And you need to don't forget that incisions are done under the Langerhans lines. Is it clear? Incisions are done in the Langerhans lines such that there is the best primary intention healing, such that it prevents the scarification of the skin. Is it clear? The second type of healing intention of the wound, we have secondary intention. Is it clear? Wound healing by secondary intention is when the first condition that is going to occur in secondary intention is that we do not have opposable tissue. So in this case, you may have something like this. When the skin is not opposable. Is it clear? Provided that you have something like this. Is it clear? You have something like this, two skins like this. So here you say that this part here is not opposable to this other part here. Is it clear? Since they are not opposable to the other part, in order to fill the gap of the known apposition, you are going to have granulation tissues. Basically, you're going to have granulation tissue that are going to produce scars. Basically, connective tissue that is going to produce the scar. Basically, so healing by secondary intention, you have the first condition is that you have non-apposible skin, basically mucous membrane. That's the first condition. You have non-apposible mucous membrane, and the second condition is infected wound. Basically, when you have an infected wound, it's also going to grow by secondary intention. Why? Because the wound is going to be impaired. The granulation tissue is going to be impaired. So the apposition that is normally done with a primary intention in non-infected wounds is not going to easily occur. So in this case, the wound is going to grow, is going to heal by secondary intention. So that's why now we now need to go to the examples of wound healing. Basically, for the examples of wound healing with secondary intention, the first one you are going to have, if you have wounds like in wounds like cuts, basically not cuts like laceration, but you have explosions, blast injuries. Basically, so if you have explosions or blast injury, you may not have exact apposition of the tissues, so you are going to leave it heal by secondary intention. So, and after injuries, the second one, you can have a super infected incision site. Basically, so if you have an incision site that has been infected, it is better to remove the sutures and leave the wound heal by secondary intention. The wound is going to heal by secondary intention.